Hi, my name is Tim Begley. This is a resource for how to set up telehealth and telerehabilitation for kinesiologists in the province of British Columbia. The first step is to read through the position statement from the BC Association of Kinesiologists. In this, you will see that regardless of whether you're communicating and interacting with patients online or in a clinic, you need to uphold our professional practice standards and our code of ethics. This video is aimed to help you get set up correctly and to ensure that the safety and privacy of both you and your patient is protected. The first thing I want to talk about is privacy. In order to do telehealth and telerehabilitation, you need to have secure lines for communication. This means that when it comes to an internet connection and communicating back and forth with your client, you're using an encrypted and password-protected connection. This is a connection that's not open to other people to join. So if you go to a coffee shop, even though they're giving you a password, other people can join that network and you're agreeing to terms and conditions that indicate that this is not a secure channel. This would not be appropriate. And also, for you as well as for your patient, both of you need to be on secure encrypted connections. A home internet connection where you have the ability to change the password and ensure that it is encrypted will be appropriate. And if you have something like that or access to that type of connection and your patient does, then this is really something important that's going to be required in order for you to proceed with telehealth and telerehabilitation. Also, with respect to phones and digital services, a LTE, 3G, 4G data connection is encrypted and is considered secure and protecting your privacy as well as the privacy of your patient. When you're on your computer and you're interacting with your patients, whether it's a video conference or sending exercise routines back and forth, you need to ensure that the software programs that you're using comply with the Freedom of Information and Protection of Privacy Act. See the below resources on some known programs that do comply, as well as some known programs that don't comply, to make sure you're setting up the right system to be able to communicate back and forth with your patients. Next, we're going to move on to safety. It's important that as healthcare providers, when we're interacting with patients, if you're doing a video conference, for example, that you are prepared in case there's an emergency. Now, this means that you may need to phone 911 and dispatch them to your patient's location. So first, you need to know the location where your patient is, in case you need to phone 911 and direct them to that location. Secondly, you need an emergency contact for your patient in case the feed cuts out and you're not able to reach them. It's prudent to have 2 contact numbers for your patient or 2 ways to get in touch with them, plus an emergency contact. Also on this note, your patient needs to have 2 ways to get in touch with you in case they have an emergency. You can use your personal cell phone to phone patients and block the number so that they don't gain access to your personal cell phone number. However, your patient still needs 2 methods to get in touch with you, and if those methods are not secure, for example, a Skype phone number, then inform your patient that they can contact you that way in the case of an emergency, and you will phone them back from a secure channel where they can tell you what's going on. Next, we're going to talk about consent and charting. First of all, it's up to you to determine if telehealth and telerehabilitation is appropriate and beneficial for your patient before you offer this service to them. Things like language barriers, equipment required, where they are in their treatment plan, as well as other factors are going to determine if this is something that's appropriate and it's going to be beneficial to them. After that, obtaining their consent is the next step. So explaining to them what this is and what's going to be required of them. Things like a secure internet connection, but also what the session is going to look like. Is this education on a specific topic that's relevant to them, and connecting it to how this relates to their rehabilitation, what they can expect from you in terms of the length of time that this is going to take. All of these are important to explain. Chances are the patient has never done telehealth with a kinesiologist before, and so we want to be very clear about what it is and the expectations around video. How long are they expected to be on a video conference with you for? What are the expectations from them, and what are the things that you're going to do to support their recovery? After they understand what telehealth and rehabilitation is about, it's important for them to give verbal consent. See the BC Association of Kinesiologists guidelines on consent for telehealth and telerehabilitation. As soon as they have given consent and you are starting treatment, it's important to start charting and keeping accurate records. If you're prescribing exercises and you're going to be sending that to them, keeping a record of which exercises you're sending at which time. If you're providing education to them, then keeping track and charting the details of the treatment that you're offering. It's important that you accurately chart for all of your telehealth and telerehabilitation sessions. What is the treatment that you're delivering to your patient? All right, on to billing. Now, telehealth is very new, and it's unlikely that unless you follow the appropriate steps that you'll be able to bill for telehealth and telerehabilitation. First of all, you want to get approval from your patient's adjuster or claims specialist. It would be wise to let them know that you're familiar with the BC Association of Kinesiologists position statement, policies, and procedures as it relates to telehealth and telerehabilitation. Then be clear on how much time you're going to be doing this session for and what the outcome is. It is appropriate to bill for patient education, and I think this is one of the most valuable formats for patient education. It may also help if you explain to them why this patient is going to be well suited for telehealth and telerehabilitation and what you hope to accomplish during these treatments. After you get approval and you complete the session, I would suggest billing for them quite promptly. I hope that this video has been useful to you to understand how to get set up with telehealth and telerehabilitation. This is meant to be a supplement to our professional practice standards, our code of ethics, and the position statement on telehealth and telerehabilitation. So make sure that you read those documents through carefully.